Okay, when you guys look at this picture, what do you see? Maybe a beautiful elderly couple who don't have a care in the world, but what you can't see is the pain and suffering and struggles that they've gone through over the past 3 years. See, those are my grandparents, and in September of 2010, my mom was diagnosed with 2 types of stage 3 invasive breast cancer. As you can imagine, it was a struggle for her and my family, but it was a long 2 years full of various doctor's appointments, chemo treatments, and radiation treatments. But through 2 lumpectomies, endless prayers, and consistent medical treatments, my mom is now in remission today. And through the last 3 years, I've learned just how life-changing breast cancer can be, not only for the patient, but for families as well. So with that being said, in this speech, I'm going to explain to you what breast cancer is, how you can detect it, how you can treat it, and how you can support a loved one who has it, so you in turn can help spread awareness for breast cancer. So what is breast cancer? The National Breast Cancer Foundation Incorporated describes it as a cancer that forms in the cells of the breast and surrounding tissue. The breast milk-producing ducts and glands, on the left there, are the 2 most likely places to develop cancerous cells, but they can also occur in the surrounding lymph nodes, which are under your armpit. My mom's cancer was in 2 different places, those of her left breast and her left armpit. And there are 5 different stages of breast cancer, 0 through 4, 4 being the worst. And the stages are based on the size of the tumor, which is an abnormal growth of tissue due to cancerous cells within the breast, the number of lymph nodes affected, and the signs indicating whether or not the breast cancer has invaded other organs of the body. There are many different types of breast cancer, and they all fall under 2 categories: non-invasive and invasive cancer. The non-invasive cells remain in the particular location of the breast without spreading to surrounding tissue, lobules, or ducts. The invasive cancerous cells break through normal breast tissue barriers and spread to the other parts through the bloodstream and lymph nodes. Okay, so breast cancer is the 2nd leading cause of death in women in America. Actually, there aren't very many women in here, but for every 8 of us, 1 will develop cancer, breast cancer in their lifetime. And about 39,520 women died in the United States alone in 2011 just from breast cancer. It sounds kind of scary, but guys can be affected too, because each year has shown that approximately 2,190 men are diagnosed with breast cancer, and of those men, 410 of them die. Okay, now that we know what breast cancer is, let's see what the symptoms are for early detection and how you can prevent it. According to the American Cancer Society, any unusual changes in the breast area can be called a symptom. This ranges from a new lump or mass you can feel from around the nipple to the armpit, to skin irritation and dimpling of the breast. Just make sure you do a monthly self-examination and notify your doctor if you see any changes or feel any changes, especially if your family has a history of breast cancer. There's no exact way to prevent it either, but the Fred Hutchinson Cancer Research Center said that there are 3 main factors that you should avoid to lower the risk of developing breast cancer. Okay. So taking combined hormone replacement therapy can increase the risk for breast cancer and increase the risk that cancer will be detected at a more advanced stage. Unhealthy eating habits and staying overweight. Obesity raises risk of breast cancer after menopause, which is the time of life when most breast cancer occurs in women. And alcohol and smoking. Research shows that drinking more than 1 glass of alcohol a day and long-term smoking is linked to the increase of breast cancer. So when my mama went for her annual mammogram that August, she did not expect her results to come back as positive for breast cancer. So naturally, her first question was, how can it be treated? So first she had to choose a medical team from the local hospital. And then her medical team came up with a special treatment plan based on the stage of cancer it was, the type of cancer it was, how old she was, and whether or not she's been treated for cancer before. According to the National Breast Cancer Foundation Incorporated, there are 5 standard treatment options for breast cancer. Surgery, radiation, hormone therapy, chemotherapy, and the last one, I can't see it there. I don't know what that is. Okay, sorry guys. Well, most women decide to receive a combination of the treatments, and every case is unique. My mama decided to have 2 lumpectomies and chemotherapy. A lumpectomy is a surgical operation when only the cancerous lump is removed from the breast, leaving the original breast intact. And the chemotherapy that she chose actually took over 1.5 years to complete in itself. And then it was followed by 35 weeks of radiation. Both are very painful procedures, but she hasn't had any signs in over 1 year, so I think that she made the right decision. And once my mama decided to which treatment was best for her, we had no choice but to fully support her. It's been said that some of the best treatments for breast cancer patients is the love, faith, and support of family and friends. God forbid you ever have a loved one diagnosed with a terrible disease. Just remember that even the smallest gestures mean the world to them.